and welcome back. Today we are going to do the skill donning PPE, emptying a urinary drainage bag, measuring the urine output, removing PPP, and hand washing. All of the test out skills can be found in this booklet. Go to hdmaster.com, Headmaster's website, click on Minnesota, and then search for the tab that says Minnesota Mock Skills. You can print that off, and all of your test out skills are within this book. They're not trying to hide anything from you. They're telling you exactly how to perform the skills, giving you a step-by-step summary. Remember, at test out, you need to get 80% on every skill, and you need to make sure that you're hitting every critical step. If you miss a critical step, then you fail that particular skill. And again, the grades aren't averaged. It is 80% on each skill that you get. So let's move over to going through this, making sure that you're paying attention to when it says before and after. Otherwise, you can do steps a little bit out of order, just making sure you hit those before and afterwards. All right, let's begin. So start every skill, hand sanitizer. I want clean hands. And then I'm gonna come, and with this skill, the supplies should be set out for you. The only thing you'll need to grab is the size gloves that you need, okay? So with this skill too, we're treating this patient, there'll be somebody laying in that bed that you will address as them being in an isolation room. So I wanna make sure that I gown and glove, I go into the room and I do my thing, and then I'm gonna finish all my tasks within that isolation room and come out and take it off. So let's start. When I put my gown on, I want to make sure my gown is not touching the floor. Floors are dirty. I'm sure you've been told that. So I just don't overthink this. You have clean hands, you're just putting on a gown, okay? And they want to see that you've covered up your backside. Sometimes there's an extra to go out like that. Find it here. And then you just tie this behind your back. You can tie it in a knot, you can tie it in a bow, doesn't matter, just tie it. Make sure that you're covered in the back, and then you would take your sticky, your hair will be up at test out, and you just make sure this is connected on the other side. And now I'm going to put my gloves on. Oops. When I put my gloves on, I'm going to pull this up to the palm of my hand, and when I put my glove on, I'll just slide it over so that my wrists are covered. Again, I'm going to pull this up. I did myself too tight there. The palm, put my glove on, and I'm ready to roll. I'm going to grab my supplies that are set out here. Knock, knock, knock. Hi, Pat. It's Karina. We're going to get your catheter bag empty. Do you have any questions? No? Okay. So I have 2 of these paper towels, one for up on the table and one for on the floor. So I'm just going to set everything right here on the floor. I do raise the bed up, because sometimes by doing that, this isn't a step on this skill, but it helps me have a little more room between the catheter bag and my graduate on the floor. So everything's set up here. I unclip here. You might have a different type of bag than we have used in our classroom here. And then I just clip that, undo the clip, and I just empty everything that's in the bag, and I don't want to touch the inside of the graduate with this the drainage area. I might have to lift it up, make sure I get everything out. Once I get all the fluid out, I'm going to clip it. I'm going to grab my alcohol wipe. I keep it in my hand here so I have good control of it. And then I just take my alcohol wipe and I wipe the tip. Got good control here. And I wipe here. I don't want this touching everything around me. And I just clip it back in there. That is it. Now this is garbage. I take this, I set it on my paper towel here, I can throw this in the garbage. So now I come down and I can measure. So I have 200 milliliters in my graduate. I can chart that at this time because remember, this is an isolation room, so everything has to happen in here. So now I've charted it. Now I can clean my supplies. I'm gonna empty, I'm gonna rinse, and I'm gonna dry. I'm just gonna set this back on this table here, and now I am done. Now from here, I'm gonna do my post-step. Seems wrong with my gloves on, but I'm in an isolation room. All right, Kat, there's your call light. Here's your table. And I raised the bed up. Remember, this isn't a step you have to do. I just give myself more room. So if I raise it, I have to lower it. All right, Pat, thanks. Have a good day. Now this I can either hand to the test observer or just set back down on the table. Now this is where there's a critical step. The critical step I didn't mention there is that you have to be within 25 milliliters of what your test observer gets. And then this is the first step, needs to be the bolded step, is to take your gloves off first. So you're gonna go dirty to dirty, pull your glove down. You can either throw this into your garbage or hold it in the palm of your hand, whichever. And now I'm just gonna scoop on the inside of my glove and pull my glove down. Now this was on the inside, so I can touch that. I'm gonna throw that away. Now I'm gonna break at the neck, and I'm gonna just grab here and break at the back. I'm going to pull this off. I'm touching on the inside of my gown. I don't wanna touch the outside. The outside is dirty. So I just pull this away from me, and I pull this down, holding on. My arms are always held out in front of me, and I kind of just do the same thing here. Just grabbing this down. When I grab here, my hands stay out, and I roll this away. I don't want this to come back up and hit me, and I don't want it to touch my uniform. So I slowly roll it away from me. When I get down to here, I'm just gonna throw that into the garbage. I don't wanna put my hand back in and push it down. It's dirty. And I'm gonna end this skill with a full hand washing. Turn my water on, hands get wet. I get a couple pumps of soap. Whoa, I missed it. And then I wanna look at the clock, so because I need my bolded step, critical step is 20 seconds. Don't need to worry about it if I do it right. I'm gonna do the palms of my hands, the tops of my hands, I'm gonna do my wrists, and I'm gonna do each individual finger. Again, I do it right, don't need to worry. I'm already past 20 seconds, and I do my fingertips. Now I'm gonna rinse my hands off, not recontaminating or touching the inside of that sink. I'm gonna dry my hands from fingertips down, from cleanest to dirtiest. I'm gonna do my other hand from fingertips down. I'm gonna grab a new paper towel. I just bunch it up, and then I just tap, tap, throw it in the garbage. My skill is done.